Hi, my name's Kate Jones and I'm the Director of Nursing for the Children's Care Group here in the Trust, and I've been asked to be this week's voice of RDaSH. The Children's Care Group has both a physical health and a mental health directorate, and we provide a range of services from our public health 0 to 19 offer to specialist targeted interventions supporting across all three areas within the Trust. We know that the COVID pandemic had a significant impact on children and young people. COVID influenced their development and their education, and we continue to see the impact of this today. Nationally, we are aware of the difficulties that children's services are facing, and locally we're working really hard to ensure that our children and young people do not become the forgotten generation. Before I go on to share some of the incredible work undertaken in the care group, I've been asked to speak a little about myself, to share my personal journey and what drives me in this role. Coming from a family in which pretty much everybody worked in the military, health services or the police, I think I was destined to join a public service, and I've worked in the NHS for about 19 years now. I'm a mental health nurse by background, and some of my personal story, including losing my brother to suicide, drives my passion to improve the quality and effectiveness of the care that we provide, and supporting people to navigate what can be a really difficult life by ensuring that they have access to the right support at the right time. For me, the culture of mental well-being, the conversations we have around this, and the support and guidance that we share with our own families, our friends, and with each other in our staff rooms and our offices is central to not only improving the work we do, but also improving the way we do it. Remembering that help starts at home, and for us in RDaSH that means in our communities and in our teams, it means we must be kind to each other. It also means that addressing health inequalities as early as pre-birth is imperative to achieving long-term positive outcomes. That being said, I'm also proud to say I'm a registered health visitor, and this additional experience, as well as being lucky enough to have two wonderful children, makes me appreciate the privilege I have in this role to influence and support the systems that are dedicated to ensuring the best start in life for children and young people. Our 0 to 5 services in Doncaster and North Lincolnshire are BFI Gold accredited, and we cannot underestimate the work that these services do to support strong foundations for good health and well-being. Which brings me back to the Children's Care Group and the work that we've been focusing on over the past few months. All our mental health teams have been working incredibly hard to meet the Promise 14 target of a 4-week wait, ensuring that young people and not having to wait to get the help that they need at the time when they need it. I acknowledge and sincerely appreciate the work that each and every clinician, admin colleague, pathway lead and manager has undertaken on this. We're now focusing on working to ensure that our systems can capture the work we do in a way that makes a bit more sense for our pathways in the care group. We're also focusing on our neurodiversity pathways, and our clinical lead, Dr. Marianne Smith, along with the physical health leadership team, has been fundamental in shaping these to become the most efficient and effective that they can be, taking into consideration the significant numbers of families that are awaiting assessments and not just focusing on those we are actively seeing. Moving forward, I'm excited for the care group to roll out our agreed safety metrics with a focus on our Always events. This will also be a time to drive our ambitious quality metric. Led by our Physical Health Directorate, we are focusing on toilet training. Promise 17 is all about ensuring children are ready to start school, which is addressing one of the biggest health inequalities in the country at present, and the Children's Care Group is very proud to be at the forefront of such important work. We're working with the Grounded Research team to capture this project and see what we can learn from it. As a care group, research is something we are very passionate about, and we want to continue to learn from and shape our future services based on the experiences and voices of children and young people themselves. Working with children and young people is very much systems-based. Not only do our teams function effectively within their own MDTs, but a lot of the work they do is with partner agencies, which can bring with it a different level of complexity. I want to say a huge thank you to all our teams and our corporate-based safeguarding team who navigate through complex, challenging and sometimes very distressing situations, ensuring that we are protecting our children and young people from harm. Now, the final thing I wanted to talk about is not linked to a specific promise, but rather weaved into everything we do. Nurses, midwives and nursing associates are bound by the NMC Code of Conduct to practice kindly, safely and effectively. At times, these professional standards are not upheld, and when that happens, we must follow processes to protect the safety of the public, to promote public confidence in the nursing workforce, and to maintain proper professional standards and conduct for members of the nursing profession. As a nurse and as a Fitness to Practice committee member with the NMC, I was appalled at the findings of the NMC's recent culture review, detailed in the report published in July. The report highlights unacceptable behaviour, racism, and it shares details of registrants who have died by suicide whilst in the system of the Fitness to Practice process. There is now a lot of changes to be made and work to do to improve this for all registrants in the future. In the meantime, I would like to reach out to anybody who is currently going through these processes, or anybody who has been through these historically, and encourage you to seek whatever support you may need. Thanks so much for taking the time to listen to me today. I hope you all have a lovely weekend and enjoy the rest of the summer.